High blood pressure is often called the silent killer. This is not a dramatic overstatement, it is a clinical fact. It earned this grim nickname because it can exist for years, even decades, without causing a single noticeable symptom. While you go about your daily life feeling perfectly fine, this condition can be silently, relentlessly damaging your arteries, your heart, your brain, your kidneys, the pressure inside your blood vessels. The very highways that deliver life-giving oxygen and nutrients to every cell becomes dangerously elevated. This constant, excessive force weakens the vessel walls, making them susceptible to rupture and scarring over time, setting the stage for catastrophic health events. The danger lies precisely in its silence. Therefore, our mission must be to unmask this killer before it has a chance to strike. One of the most commonly cited yet frequently misunderstood signs of severely high blood pressure is a persistent headache. This isn't your typical tension headache, often described as pounding or throbbing, felt at the back of the head and worse upon waking. It can signal a hypertensive crisis, blood pressure dangerously high, straining brain blood vessels. The pain is a physical signal, intracranial pressure is elevated, a red flag. Seek help. We dismiss headaches as normal. That normalization can let high pressure damage you for weeks or months. Why the headache? High arterial pressure can stretch vessels, cause fluid leakage into brain tissue. Another set of warning signs that can indicate dangerously high blood pressure involves your vision and your sense of balance. You might experience blurred vision, see floating spots or floaters, or even have episodes of double vision. These visual disturbances are not random occurrences, they are direct consequences of damage high pressure can inflict on the delicate blood vessels that supply the retina. This condition, known as hypertensive retinopathy, can progress from minor changes to severe damage, including bleeding and swelling within the eye. If you find this video helpful, please like, share, subscribe, and comment below. Alongside vision problems, you may experience episodes of dizziness, lightheadedness, or even vertigo, the sensation that the room is spinning. The high pressure can affect the blood flow to your brain, including the cerebellum and inner ear, which control balance. We might blame blurred vision on needing a new glasses prescription or eye strain from screens. However, when these symptoms become recurrent or appear together, they form a pattern that should not be ignored. The importance of recognizing these signs cannot be overstated. Paying attention and getting your blood pressure checked in response to these signals is a proactive step that can help you avert a much larger health crisis down the road. Spontaneous nosebleeds, medically known as epistaxis, can be another surprising sign of a hypertensive crisis. While most nosebleeds are caused by dry air, the nose is rich with tiny, fragile blood vessels. When systemic blood pressure skyrockets, these delicate vessels are put under immense strain. They can easily rupture under this extreme force, leading to a sudden and sometimes profuse nosebleed. Similarly, you might experience heart palpitations, racing, pounding, fluttering, even skipping beats. This sensation, which you may feel in your chest, throat, neck, can be frightening. When your blood pressure is high, your heart has to work significantly harder. The heart muscle can thicken. The chambers can enlarge. The challenge with these two signs is that they have many other, often less serious causes. The key is to look at the context. Do not ignore these messages. They are urgent communications from your body, and that it's time to seek a medical evaluation. Feeling short of breath, a condition known as dyspnea, particularly during light physical activity or even while at rest, can be a serious indicator of the toll high blood pressure is taking on your heart. When your blood pressure is consistently high, your heart muscle must work much harder with every beat. Over time, this chronic strain causes the heart muscle to thicken and stiffen, particularly the left ventricle, leading to a backup of pressure into the lungs. This fluid congestion in the lungs is what makes it difficult to breathe. Chest pain or angina is another classic and alarming symptom. It can manifest as a feeling of pressure, squeezing, fullness, tightness in the center of the chest. The pain might also radiate to the shoulders, neck, arms, or jaw. This discomfort occurs when the overworked heart muscle is not getting enough oxygen-rich blood. High blood pressure contributes by accelerating atherosclerosis. The great danger here is misattribution. Seek immediate medical evaluation. Finding blood in your urine, known as hematuria. While it can be caused by a urinary tract infection or kidney stones, it can also be a sign of damage caused by high blood pressure. Your kidneys are made up of millions of tiny filtering units called nephrons. When your blood pressure is chronically elevated, this extreme force damages these fragile vessels, causing them to scar and leak. Another subtle yet telling sign is facial flushing. While flushing can be triggered by many things such as embarrassment, hot weather, spicy foods, or alcohol, it can also occur when blood pressure spikes. The body may be trying to accommodate increased blood flow by widening these surface vessels. Finally, persistent and unexplained fatigue can be a symptom of advanced high blood pressure. This is not the normal tiredness you feel after a long day. This fatigue stems from the heart's struggle to pump blood against high resistance, and the reduced efficiency of circulation means your muscles and organs may not be receiving optimal oxygen. These three signs, blood in the urine, facial flushing, and fatigue, are often overlooked. Paying attention to these subtle signals and discussing them with a healthcare provider can be the key to diagnosing and managing hypertension, before it leads to irreversible kidney failure or heart damage. One of the primary drivers of high blood pressure is sitting right on your dinner plate. Its main accomplice is sodium. Our modern diet is honestly just saturated with salt, but most of it doesn't come from the salt shaker. It comes from processed foods, prepackaged foods, restaurant foods. Sodium acts like a magnet for water in your body. When you consume excess salt, your body retains more fluid to dilute it. This extra fluid increases the total volume of blood circulating through your vessels. Think of it as overinflating a tire. The container is the same size, but pressure rises. The standard Western diet is not just high in sodium, it is also profoundly deficient in potassium. Potassium is a crucial mineral that counteracts the effects of sodium. It helps your body excrete excess sodium and encourages the vessel walls to relax, which directly lowers blood pressure. It is abundant in whole plant foods, fruits, vegetables, beans, sweet potatoes. Your kitchen can be either a laboratory for creating disease or a sanctuary for cultivating health. While diet is a cornerstone, other lifestyle factors play an equally powerful role in the development of high blood pressure. Chronic stress is a major contributor in our modern, fast-paced world. When you experience stress, your body releases a cascade of hormones, adrenaline, cortisol. These hormones trigger fight or flight, causing your heart to beat faster and your blood vessels to constrict. But when stress becomes chronic, work pressure, financial worries, relationship issues, the body remains in high alert. Another significant risk factor is a sedentary lifestyle. Regular physical activity helps keep your heart strong and arteries flexible. Exercise stimulates production of nitric oxide, a compound that relaxes and widens blood vessels, which helps lower blood pressure. Excessive alcohol consumption is another well-documented cause of high blood pressure. Carrying excess weight, especially around the abdomen, is one of the strongest predictors of high blood pressure. The more you weigh, the more blood you need to circulate, translating to more pressure on artery walls. Fat tissue releases hormones and inflammatory substances that contribute to higher blood pressure. The good news? Even a modest 5–10% weight loss can reduce your blood pressure, making it a powerful strategy for prevention and treatment. Limiting alcohol intake is a direct and impactful step you can take and help keep your blood pressure within a normal, healthy range. The most powerful tool you have to lower your blood pressure is not found in a pill bottle. It's found in the produce aisle of your grocery store. Adopting a diet rich in whole plant foods is the single most effective lifestyle intervention for preventing and treating hypertension. The goal is to flood your body with nutrients that actively work to lower blood pressure. Start by dramatically increasing your intake of potassium-rich foods: sweet potatoes, spinach, beans, lentils, bananas, beets, arugula, Swiss chard, and other leafy greens are packed with dietary nitrates. When you consume these foods, your body converts nitrates into nitric oxide. Nitric oxide signals your artery walls to relax and widen. This widening allows blood to flow more freely, lowering the pressure in the system. Berries, blueberries, strawberries are rich in anthocyanins that improve artery elasticity. Whole grains like oats and barley with soluble fiber can lower systolic and diastolic pressure. By consistently choosing these whole foods, you are nourishing your blood vessels and giving your body what it needs to maintain healthy, normal pressure. Taking control of your blood pressure and securing your long-term health does not require a radical life overhaul. The journey begins with small, consistent, and manageable steps. The first and most critical step is to know your numbers. You cannot manage what you do not measure. Make a commitment to get your blood pressure checked regularly, at your doctor's office, a local pharmacy, or with a validated home device. Logging your readings transforms the silent killer into a known quantity. Your action plan should be built on a foundation of movement. Start with a brisk 30-minute walk each day. Take the stairs, park farther away. Find an activity you enjoy: dancing, gardening, swimming, cycling. Dedicate 10 to 15 minutes each day to calming practices. Deep breathing, guided meditation, gentle yoga. These practices lower stress hormones and slow your heart rate. Every meal is an opportunity to nourish your body with potassium-rich plants instead of sodium-laden processed foods. Every day is an opportunity to move your body and manage your stress. By making small, deliberate choices, you are not just lowering a number, you are investing in your future. Your healthier future starts with the very next choice you make. Thank you for watching. Don't forget to like, share, subscribe, and comment your thoughts below.